Hello all, let's talk regarding the muscles of the mastication. These muscles of the mastication include the temporalis muscle, masseter muscle, medial pterygoid muscle and lateral pterygoid muscle. Before going into the details of these muscles of the mastication, let's orient with the bony landmarks from where these muscles are going to arise. Now let's see, this is the lateral view of the skull. And this study, it is called as the norma lateralis. Here we can see this is the temporal lines which is going to continue below and behind with this zygomatic arch through the supramastoid crest. And here this is the floor of the temporal fossa, and this temporal fossa floor, it is going to be formed by this frontal bone, this parietal bone. This is the greater wing of the sphenoid bone, and this is the squamous part of the temporal bone. The meeting point of these four bones, that is called as a pterion, and this is the important site for the surgeon because just medial to this pterion, middle meningeal vessels lie, as well as the lateral sulcus of the brain also lie. Here this is the zygomatic arch, and this is the temporal fossa which is going to communicate through the infratemporal fossa via this gap between the zygomatic arch and the lateral side of the skull. So this area, it is this area for the infratemporal fossa, where we can see this is the maxillary prominence, and this is towards the posterior side of the maxilla, and this is the pterygoid process having the lateral plate of the pterygoid process, and this is the lateral surface of the lateral plate of the pterygoid process, and this is the medial surface of the lateral plate of the pterygoid process, and this plate, it is the medial plate of the pterygoid process. Here we can see this is the styloid process, and it is just anteromedial to this mastoid process. This is the mandibular fossa, where the head of the mandible, or we can say condylar process of the mandible, it is going to articulate like this and going to form the temporomandibular joint. Here the roof of the infratemporal fossa, it is going to be formed by this infratemporal surface of the greater wing of the sphenoid, and this lateral surface of the greater wing of the sphenoid and infratemporal surface of the greater wing of the sphenoid, it is separated by each other by this crest, and this crest, it is called as infratemporal crest of the greater wing of the sphenoid. Now when we see the attached mandible with it like this, this is going to form the temporomandibular joint, and both these temporomandibular joints, they are the condylar variety of the joint, where the head of the mandible, it is called as the condylar process, which is going to articulate with the mandibular fossa of the temporal bone. This notch, it is called as the masseteric notch, and in front of the masseteric notch, this prominent projection, this is called as the coronoid process. Here this is the ramus of the mandible, lateral surface, and this is the ramus of the mandible, medial surface, and this is the body of the mandible. So angle between the two, the ramus and body, that is called as the angle of the mandible. Now let's see the details of the temporalis muscle. This temporalis muscle, it is going to arise from this floor of the temporal fossa below this temporal lines, and it is a fan shaped muscle which is going to arise from the floor of the temporal fossa except the zygomatic bone, and the fibers of this temporalis muscle, they converge, and these converged fibers, they are going to form one tendon, and that tendon, it passes below this zygomatic arch and it converges to attach at the tip as well as the anterior border and the medial surface of this coronoid process. This temporalis muscle, it is covered by one fascia, and that fascia, it is the temporal fascia, and this temporal fascia, it is the tough fibrous portion which is going to attach at the zygomatic arch below, and above this fascia it is attached with this temporal lines. So the temporalis muscle, it is covered by this temporal fascia. So this temporalis muscle, it is also going to arise from the inner surface of this temporal fascia, so having the dual origin, fibers arising from the bony parts as well as the fibers arising from this temporal fascia inner surface. So after the formation of the tendon, this muscle, as it passes behind the zygomatic arch and converge over the coronoid process at the tip as well as the anterior border and medial surface of this coronoid process. Whenever this muscle get contract, it will lead to the elevation of the mandible, while these posterior fibers, they are almost horizontal, and that's why this muscle get contract, it will lead to the retraction of the mandible. This temporal fascia, from where this temporalis muscle is going to arise, which is replaced by the bone in case of the tortoise, and that's why in case of the tortoise the bony tunnel is formed by the floor of the temporal fossa and this bony temporal fascia, and in between the two the temporalis muscle is going to arise. This temporalis muscle, it is going to supplied by the deep temporal nerves, which are the branches of the anterior division of the mandibular nerve, which passes behind the zygomatic arch, and it lies deep to this temporalis muscle, and these nerves are usually 2 in number and going to supply the temporalis muscle. The blood supply to this temporalis muscle, it is via the deep temporal arteries, which are the branches of the maxillary artery, which also follows the course of the deep temporal nerve. So this temporalis muscle, it is going to be supplied by nerves as well as the vessel from its deep surface. One more nerve, it is related to this temporalis muscle, and that nerve passes behind this temporomandibular joint and lies superficial to this temporalis muscle as well as the temporal fascia, and this nerve, it is a branch of the posterior division of the mandibular nerve, and this nerve, it is the auriculotemporal nerve. You can pause this slide and revise the details of the temporalis muscle. Now let's see the attachment of the masseter muscle. This masseter muscle, it is a quadrilateral muscle which is going to arise from the zygomatic arch as 3 heads and going to insert over the ramus of the mandible lateral surface. So the deepest fiber of the masseter muscle, it is going to arise from the deep surface of this zygomatic arch, and these fibers, they are passes forward and going to insert over the anterior and lateral aspect of this ramus of the mandible. Over it, the intermediate fibers, they are going to arise from the lower margin of the posterior 1/3 of the zygomatic arch as well as from the inner surface of the anterior 2/3 of the zygomatic arch. And these fibers, they are vertically passes downward and going to insert over the middle of the lateral surface of the ramus of the mandible. And the superficial most fibers, they are going to arise from the inferior margin of the anterior 2/3 of the zygomatic arch, and these fibers, they are passes downward and laterally, and they passes posteriorly and they insert over the lateral surface of the ramus of the mandible after crossing the superficial and the deep fibers in X-shaped manner. So this masseter muscle, it is going to form the cruciate type of the muscle. When this muscle contracts as a whole, it will lead to the elevation of the mandible as a whole, while the superficial fibers, they are responsible for the protraction of the mandible, while these deep fibers, they are responsible for the retraction of the mandible. This masseter muscle, it is going to be supplied by the masseteric nerve, which is a branch of the anterior division of the mandibular nerve. From its deep surface passes through the masseteric notch. The tonic spasm of both the masseters is the characteristic symptom of the tetanus, and this condition, it is called as the trismus, which produces the locked jaw. You can pause this slide and revise the details of the masseter muscle.